Welcome to the Smart Care Team Spotlight, presented by Care AI, the smart care facility platform company and leader in AI and ambient intelligence for healthcare. Join Molly McCarthy, former CNO of Microsoft, as she interviews the brightest minds in healthcare about the transformational promise of AI and ambient intelligence for care teams.
Too often, technology makes caregivers' lives harder, not easier. It's time for smart technology to empower care with a more human touch. Hello, I'm Molly McCarthy, and today we are joined by Jane Sarsohn-Kahn on the Smart Care Team Spotlight. It's great to hear you and see you, Jane. Welcome.
Thank you, and I'm delighted to see you too, Molly.
I just wanted to give our listeners an overview of your amazing background. I met Jane actually in Philadelphia at an American Nursing Informatics conference. I heard her speak many years ago. She's got an amazing background. She's a health economist, advisor, and trend weaver to organizations focused on the intersection of health, technology, and people. Jane founded Think Health after working with healthcare consultancies in the US and Europe. Her clients span the healthcare ecosystem, tech, pharma, and life sciences, providers, plans, retail, financial services, and consumer goods. She founded one of my favorite blogs, Health Pop Elite blog, in 2007 and has been the sole writer of nearly 3,000 posts in her independent voice. And they're fun and interesting to read. So just a little plug. Jane advises on strategy via environmental analysis, scenario and strategic planning, market research, and health policy analysis. She sits on several advisory boards and is a frequent speaker and contributor to many publications, frequently quoted as an expert in her field. I could go on and on. I also just want to mention I'm the recipient of two of the books that she's written. I think one came out prior to COVID and then one maybe during COVID. But Jane, thank you so much for taking time out of your busy schedule to be with us today.
So delighted to be with you, Molly, especially to talk about, what smart care teams are all about and how they can be enabled through technology.
Well, great. I know that it's been a while since we've chatted, but we actually spoke earlier this year and really talked about our outlook for the tech sector, specifically in healthcare. And just wanted to get your thoughts now that we're more than halfway through the year. What are your thoughts on where we've been and where we're going? And I also want to make sure we give our audience a really broad perspective because of your health economic background. So any thoughts?
Yeah. So I guess with that we'll follow the money where healthcare is in healthcare delivery and at the center of healthcare delivery, which I think is very relevant to what you're talking about in this podcast, which is health systems and hospitals who took a hard hit in COVID, both in terms of what happened with the workforce, burnout for nurses and physicians and other frontline workers in hospitals. So the human capital of the hospital got hit hard. And then capital got hit hard. Finance, revenue, the fiscal part of capital got hit hard. And so that's what I've been tracking with respect to hospitals' ability to invest in digital transformation. So we entered the pandemic period, 2019 into 2020, really thinking about digital transformation. That's what our conferences were all about. The next generation of the internet and healthcare, the cloud computing, and the beginning of virtual care. And then COVID accelerated virtual care as part of digital health. But broadly speaking, hospitals have not financially recovered the way they had their balance sheet looking before the pandemic. Why I say this, I base this on wonderful, important horizontal, longitudinal research done by Kaufman Hall. Kaufman Hall has published since the beginning of the pandemic the National Hospital Flash Report, which they publish freely on their website, and it's a great resource. They also do one for physicians I'm not going to talk about that one today, but physicians too have had challenges fiscally. But if we're going to look at the hospital sector and finance and the ability to invest in this digital transformation, it's been tough because of supply costs, again, nursing and supplies, not just PPE, but other supplies, and the cost of some medicines in the hospital have really skyrocketed as well. So on the supply and cost side of the hospital, it's been tough. And then on the demand side, patients have not returned in the numbers that I would have anticipated when you and I spoke earlier this year. Mm-hmm. So I thought there'd be a short-term, month-to-month increase, little by little, and that the concept of medical distancing, right, people distancing themselves from the hospital, would have abated and gotten better. But in fact, we look at inpatient volumes, which are recovering pretty well, and I say that relative to pre-pandemic, but it's the outpatient volumes where the margins are typically for health systems that have not recovered universally with every health system. So you've got a gap between health systems that are doing fairly well and those that are not. And the most recent data from Kaufman Hall just came out a couple days ago. They publish these at the end of every month. So I have fresh data from July. Again, it's retrospective 1 month, showing margins declined in the last month, which was surprising to me because they were just starting to turn around and see a little black ink, and now they're below the line again. So I'm concerned because we're coming up against the fall, the flu season, RSV, maybe a triple-demic, maybe not, depends who you listen to. Right. The ability for hospitals to take a look at investing in, we'll just say digital health broadly and digital transformation has been challenging. Let me add a little sentinel event to that just came across my email in the last couple of days. So just in terms of scheduling, we're recording this on the 31st of August for those of you who might want to look up this story. And that is that one of the credit rating agencies, Fitch Ratings, had downgraded a hospital system, which I wasn't that familiar with. The Regional West Medical Center had its bonds downgraded to BBB minus from BBB plus because of some revenue challenges they had and cost challenges. But Fitch called out something that will interest you and the listeners, but really freaked me out a little bit. They called out the fact that the Cerner implementation of the EHR was costing more than the hospital had anticipated and eating into the revenues, lowering margins for the entire enterprise. So an EHR implementation, costs thereof, hit the bond rating. And we don't see that kind of granularity spoken in these documents from Standard & Poor's or Fitch or any of the other bond rating agencies. So I call that out because the work that I do, I'm always having to look around the corner in forecasting. And I'm going to be watching this now from other rating agencies to see, are we actually seeing the big iron implementations, the EHR implementations, eating into other hospitals' fiscal health? That's, I think, a warning to watch, a signal. And we want to know if that's noise or just a signal, but it's something to watch for. So, in terms of what you and I talked about 6 months ago, I'm less optimistic than I was in terms of the overall profile on digital transformation. But that doesn't mean we're not going to digitally transform. Right. Because I think a lot of this is a challenge with definitions of what we mean by digital health now. Right. And I'll stop there and you can dive into an aspect of that if you'd like.
No, I think that's important because it's like when any term comes out within healthcare, well, virtual health, what do you mean by that? Virtual nursing even? Are you talking about robots? No, we're talking about perhaps having a licensed nurse in a different physical area that's supporting a unit or a number of caregivers. And I guess to that point, I'm thinking back to some of the areas that we talked about earlier in the year in terms of remote patient monitoring. It could be in the hospital, could be outside of the hospital, and just care model changes in general, and your thoughts too, if that's impacting. You said fewer hospital patient days, et cetera. So that, that might be, I know there's a big shift looking at how can we, especially with nursing. I'm just looking at an article from McKinsey. It says nurse time could be saved through care model changes and innovations. It says current time spent on activities that could be optimized with technology. I think it says 42%, and then current time spent on activities that could be delegated 24%, and really looking to reduce that might not necessarily impact the bottom line right away, but really pushing our practitioners to the top of their license, as well as hopefully better patient outcomes and perhaps even less time on implementations or administrative tasks. So I'd love to hear your thoughts just on what you've seen in terms of care model changes within the hospital, really, if you've noticed that in your literature and what you've been reading or seeing in talking with clients. I know you're an advisor to so many.
Yeah, so I think it starts with strategy. What business is the health system in? And one of the recommendations from Kaufman Hall in this month's flash report, I agree with, and it's something that I've been talking to all the stakeholders that I talk to, whether it's pharma or hospitals, health plans, or technology companies, both consumer-facing and the bigger iron B2B technology, hospital supply tech, med tech. And that is the shift to lower cost settings, because we know hospitals mean to take on value. We talk about value-based payment, whatever guise that is. It's got many different flavors, from bundled payments to population health, et cetera. And many hospitals taking on innovation programs, initiatives with Medicare and Medicare Advantage, et cetera, and some very creative Medicaid programs. So we give props to the governors who've expanded Medicaid and are trying to cover the care for their health citizens in their states, because several states are doing some cool things with hospital to home and food as medicine, et cetera. So if we look at these institutions who want to deliver care outside of the expensive bed walls, and can do, that's then where we kick in this flywheel of let's empower nurse teams, smart care teams with dietitians, nutritionists, physical therapists, and importantly, mental health providers on the primary care team, on that smart care team that you talk about. It's all those people working together. And how do we do that? With remote monitoring, with looking at data that capture what we could call the social determinants of health, or the drivers of health, or the health risks, depending where you stand on the terminology. But it's getting data from other things besides in the claim, whether it's the prescription drug claim or the hospital and health care claim. It's getting data from sleep, what I always talk about, sex, drugs, rock, roll, sleep, emotions, health, job security, financial security. And when we can start to corral that in a smart way, which we can start to do, then we can manage the whole patient. That's when we empower nurses to operate their full license. They are complemented by lots of other providers as appropriate on that smart team. And we have the technology deployed and inspired with good design that nurses inform, that clinicians inform, and that patients inform. We need to have patient opinion leaders and patient leaders to inform this, and not that the opinion leaders need to be digital natives who understand, because that's not the point. It's who do we really need to serve and service. And so it's Mrs. Jones who wants to just get on the floor and play with her grandkids after the hip operation. That's her endpoint. For the orthopedic surgeon, it's, the nail and the screw worked really well. Thank you very much. orthopedic surgical supply company. But what does Mrs. Jones think? So, one of my favorite articles from JAMA, and I'm sure in one of our discussions I've brought this up, was from maybe 2018. It's not new, but it was titled Value-Based Payments Require Valuing What Matters to Patients. So yes, value to the hospital, value to the payer. But as the patient is increasingly the payer, she needs to be part of the input into this user-centered design world.
Yes.
Yeah. So to your point, absolutely. We can see people, clinicians like you, my favorite chief nursing officer persona, that's you, operating to your full license. Then burnout goes down, delight goes up. Outcomes go up because everybody's on the same page and is a team with the patient and her family.
Right.
So I think that's that flywheel. It's a virtuous cycle. Once you kick that in, I've seen that, work. We see a lot of success with this at Intermountain Health, which was early to hospital to home. And they put together infrastructure for that, as others have too.
And I think that's so important, in working, thinking about new care models and care at home and just acute care hospital at home. One of the things that really needs to happen within the four walls of the hospital is teaching and education. But one of the areas that we've seen really is the teaching, where you have that virtual nurse coming into the room and working alongside could be a newer nurse and really educating that family and making sure that education time and preparation for hospital at home, for example, or follow-up is on I can't say it. Let me start again. But really ensuring that time is uninterrupted with that patient, with that family, ensuring that prep and education happen prior to discharge. So that's one of the areas I think we're seeing. The other kind of along those lines really is better teaching and education, improved patient safety and satisfaction. And ultimately, I think if you ask any nurse or clinician who's working at the bedside, they want to ensure their patient is well cared for and optimal outcomes, really.
Mm-hmm. Those outcomes, there's real hard ROI on the issue of patients feeling respected and communicated with in the moment, in the exam room or at discharge. But at that moment of truth where we want to impart education, wisdom, bolster literacy, not just how to take the medicine, but when to take it, with food, without, etc. And Judith Hibbard, one of the godmothers of patient activation, patient engagement, years ago did some amazing research in Oregon with one of the big health plans and found that patients who were managing diabetes, this was a very specific population, but right. she could get the data to show this. Patients who were in the exam room with the doctor getting instructions for measuring H1C and taking anti-glucose medication.
Right.
If they felt respected, and that was the word they used in the research, in the moment,
right,
they come back in a few months and their blood sugar was more controlled and they were more adherent to the medication.
Right.
And this is everything normalized, all the data managed. So there's an ROI on respect in the moment. And if we educate, I think this is true for everybody, clinicians as well. But I mean, if we, again, have this protocol, this on our checklist to educate people and spend the time in doing the education with patients and their families, again, you bolster the outcome. And obviously, there'll be fewer days in hospital, fewer trips into the ER. That's real saving. And outcomes improved for quality of life. So Mrs. Jones can get on with her life. I think that kind of putting that in the a new kind of protocol is super important. And again, bolsters the value of the encounter across all the stakeholders.
Yeah. And I think, at the beginning, I said And I'm just going to read this again. It's time for smart technology to empower care with a more human touch. And really, even having worked in tech for so long, I mean, tech to me should be working in the background, providing that informed decision making to that clinician so that they have the information at his or her fingertips, allowing them to maintain and foster that relationship with the patient throughout that stay or in the home. And so my next question, and I know we're got a couple more questions here, but one area that we've touched upon is obviously smart care teams, but what's your gut response if I were to say, Jane, what's the cost of doing nothing in healthcare right now? What we're maintaining the status quo versus looking at these different solutions to really help foster clinicians as well as improve patient outcomes?
If we do nothing, we're going to end up in that negative margin space. We're going to lose clinicians. We're going to lose the human capital, the nursing capital. I just pulled out, in anticipation of talking to you, data from the advisory board, and they asked nurse leaders. So this is from early in August.
Okay.
Health system nursing leaders' concerns in 2023. And what's number one? More than half the nurses polled said, the market shortage of qualified RN candidates. Our sisters and brothers aren't there, coming up through the pipeline. So this impacts everybody.
Right.
This impacts every patient, every provider, every hospital, every health system, and really health plans and the profitability of plans, because nursing is where it's at.
Right.
This is where rubber hits road in caregiving. Physicians have physicians work to do at the highest of their license, and so the heck do nurses. And so that's why I'm so passionate about collaborating with SUNCL on the Nurse Hack for Health, because nurses are at the front line and they see what's going on,
Right.
and they're incredibly innovative because they spot the problems and they hack their way to solutions. So this issue of do nothing means, okay, you're not going to be relevant anymore, because people want care increasingly in this omni-channel environment. And don't forget, half the people in America are still commercially insured, and employers are providing that insurance. So employers providing insurance have demands on quality and access. And this omni-channel world is real, providing care in hospital, in the community, at home, at employers, on the go. And again, virtual and through apps and self-care, DIYing, all of this together.
Wow.
That's really the end game for now, the 1, 3, 5 years out. And so that's where this all has to go. And many providers have started to lay this foundation.
Right.
We have many examples we can point to. But those that don't start to build that infrastructure, and again, educating the providers, nurses, physicians, the allied health professionals, and come along with patients, because patients' minds are already there.
Right.
I want care this way.
And, I don't know, I don't think we have time here today, but just even the next generation of caregivers who are already in the workforce. And I think I forget what I read recently, how many generations are in the workforce right now, 5 maybe.
Yeah, up to 5, depending on the company.
Right. And so you have that generation coming in who's very tech savvy and used to, and so they're going to gravitate towards those opportunities that, have tech as part of the solution and platform, quite frankly, in my opinion. So anyway, one last question here, and I know I could talk to you all day, but because if you think about the listeners of this podcast, perhaps CNIOs, their care teams, healthcare executives, if you could reach out and just give one practical piece of advice today to one of them, what would it be?
Embrace virtual care and develop a strategy where you're empowering your clinicians to operate in that new environment, rewarding them to be innovative and meet the patient where he and she are, which to your point about younger people in the workforce, older people really got digital in the pandemic, using Zoom and Teams and FaceTime with grandchildren, reading to them. And now they're on that journey to being digital immigrants, not digital natives. And so, this is normal now. That digital divide is closing through demographic aging, of course, but also because older people actually have learned to cotton onto this stuff, and they register for Part D Medicare. They're drug lists on there, and they're engaged, and they vote. And so, I've learned a lot about older people in the pandemic and younger people in the pandemic. And so I think we need to meet people where they are now. And I think the future is this omni-channel thing, which we're doing in retail and in banking. And it's also the reality for healthcare now. Financially, it has to be the reality because we have to find lower cost places to do things that are safe and clean, hygienic. People like that idea, So I think that's my one piece of advice. Yeah. Sit still. You don't have to do the unified field theory of everything at once, but figure out how do we meet all these touch points, keeping the person, the patient, the caregiver at the center.
Right.
And then lots of clinician involvement and what that looks like, partnering with the patient as a co-designer.
Yeah, I love that. Partnering with the patient as a co-designer. Jane said it first. So I just want to say thank you, Jane. I really appreciate connecting with you today and look forward to future discussions, and just want to say thanks for listening, and you can join us on future episodes of the Smart Care Team Spotlight. We look forward to seeing you there. Thanks, Jane.
Thanks, Molly.
Thanks for listening to the Smart Care Team Spotlight. For best practices in AI and ambient intelligence and ways your organization can help lead the era of smart care teams, visit us at virtualnursing.com. And for information on the leading smart care facility platform, visit care.ai.